Hey guys, welcome back to another rapid update. In this video, we're going to talk about health technology assessment methods for the inclusion of medicines in South Africa's National Essential Medicine List. Stick around. So this is part 2 in recorded videos speaking about the Health Technology Assessment Methods Guide published on the 14th of June to inform the selection of medicines in South Africa's National Essential Medicine List. In part 1 of these recorded videos, I spoke about a set of principles to apply to health technology assessment and analysis of this methods guide. I also spoke about who funded the project and why it's being funded, and also looking up ahead into the future, possible implications short term and also long term in the implementation of health technology assessment. In the second part of the recorded videos, I'm going to be talking about cost-benefit analysis when applied to health technology assessment as a policy option amongst several others to improve access to newer healthcare technologies. The third part of this recorded videos will speak about the supply and demand for health technology skills and expertise in South Africa, and also when looking internationally. And the fourth part of the recorded conversation is dedicated to technical issues embedded within this report that would be useful to highlight and to speak about a little bit further. So let's jump straight into talking about cost-benefit analysis of health technology assessment. And when I'm referring here to cost-benefit analysis, it is another methodology within health economic evaluations or health economics generally that compares the benefits in monetary terms to the costs, also in monetary terms, of implementing any intervention. In this case, we're seeing the intervention as a health technology assessment system or process in South Africa with the objective to improving access to newer healthcare technologies. Healthcare technologies here could include medicines, medical devices, vaccines, new surgical procedures, robotic surgery, utilization of AI in healthcare systems across the board. Anything that is new in health tech, one could potentially apply these assessment methods. But cost-benefit analysis aims to quantify the benefits, quantify the costs, and determine whether the benefits outweigh the costs. And if they don't, are there any other potential alternative options to achieve access to newer healthcare technologies that may be more efficient? And a good case in point to talk a little bit further about this is the application of cost-benefit analysis in policy analysis. And the example that I'm most familiar with, and I'm sure other OECD countries also have a similar framework, but this is Circular A4, published and updated September 2003. It may be somewhat dated, but this is a circular published by the Office of Management and Budget, and this is from the presidency in the United States, part of the White House. So if you do a search specifically for this term in this circular, you'll be able to find it. But the intention in putting together this extensive document, 48 pages, was to talk about putting together a set of methods and recommendations to guide federal agencies on the development of regulatory analysis as required under this particular section. So the methods described in this document over here is to assist analysts in regulatory agencies by defining good regulatory analysis, or also policy analysis, serving as a tool for regulatory agencies to use to anticipate and evaluate the likely consequences of policies, provides a formal way to organize evidence on key facts that are good and bad, or various alternatives that should be considered in developing regulations. So the idea here, the unit of analysis, is looking at a specific policy intervention, determining what the various alternatives are, and then quantifying the costs associated with it, and then also the benefits. The primary motivation is to learn if the benefits of an action are likely to justify the costs. This is a first key point. The second key point is to discover which of the various possible alternatives would be most cost effective. Benefit cost analysis is a primary tool used for regulatory analysis. As I've mentioned, provides a clear indication of the most efficient alternative alternative that is generates the largest net benefits to society. And to my knowledge, there isn't a similar cost-benefit analysis framework that is being used to guide which policy options are available for improving access to newer healthcare technologies in South Africa. And I want to apply some of the basic analytical elements. In good policy analysis should include the three basic elements: a statement of the need of the proposed action, an examination of the alternative approaches, and third is an evaluation of the benefit and costs. I want to take these three basic elements and now apply it to health technology assessment and see if this helps us a little bit more to disaggregate whether in fact a health technology assessment system is a worthwhile policy option for improving access to new healthcare technologies. So let's jump back into the methods guide and have a look at the statement of need. The first observable indication of this is references to that HTA in South Africa is anchored in the ideas of universal healthcare coverage, ensuring that no one is left behind, that everyone has access to basic healthcare services, that is funded through the state, through a network of state healthcare providers, but basically providing coverage for every single person that is within the political boundaries of South Africa. Universal healthcare coverage is one of the key statements of need, but then also motivated within the document for escalating morbidity and mortality, and the requirement to and the need to provide access to newer healthcare technologies. This statement of need is also a little bit more apparent on this page over here, which is that the Essentials Drug Program health technology assessment process is anchored in the objectives of universal healthcare coverage, which means decision makers are interested in improving health across the whole population, not only within one specific group. It's fairly easy in the context of health technology assessment to establish what the need is, given the current high levels of non-communicable diseases and related mortality and also morbidity that's attached to it. So let's jump into looking at the different costs and the benefits that are associated with health technology assessment. You may recall in the first recorded video that I suggested a few basic principles for looking at health technology assessment. There were increased transparency, adherence to timelines, predictability, decision making, budget commitment, and also conflicts of interest. The second last point there that I mentioned, which is related to budget commitment, is a key component of a cost-benefit analysis, particularly on the benefit side. In having looked at this entire document, there's no clear indication that the National Department of Health has set aside a amount of the national budget for funding of newer healthcare technologies on a sustainable ongoing basis. The proposed methods guide clearly signals the intention to formalize health technology assessment, but it's unclear what those benefits are going to be. I want to provide an example to perhaps illustrate what a clear commitment, what articulation of clear commitment may look like and funding of it. This resource over here, which is from the Ministry of Health in Israel, identifies recently, beginning of 2021, how the Public Committee for the Expansion of Healthcare Services Basket, or the Healthcare Basket Committee, recommended for the year 2021 an increase in funding for 117 medications and technologies for treating over 170,000 people at a total cost of 550 million Israeli shekels. This is approximately 170 million US dollars just for the year 2021. The National Healthcare Basket Committee is comprised of a range of different healthcare stakeholders, from healthcare providers, patients, Ministry of Health institutions, key opinion leaders, providers, HMOs across the entire spectrum of the healthcare system, where they get together to determine within a allocated budget per year of all of the different options that are available to potentially fund, which are going to be funded and which are not. And then the Ministry of Health publishes a list of medication and also different interventions that would be funded. For example, new groundbreaking medication for cystic fibrosis was included. New groundbreaking medication for cardiac amyloidosis was included. New medications for oncology patients were included across breast cancer, prostate cancer, colon cancer, amongst quite a few others. New genetic screening testing across several groups in Israel were also included. Now, I'm not suggesting by any means that the National Department of Health in South Africa would achieve the same levels of funding for newer healthcare technologies or covering a significant range of population. What I am suggesting, though, is that the Ministry of Health in Israel is clearly signaling and also providing a concrete budget commitment to providing access to newer healthcare technologies. There is no such level of commitment at the National Department of Health in South Africa to do likewise. And I think in the context of this budget commitment principle, when looking at health technology assessment, the healthcare methods, the HTA methods guide could be significantly improved if it was also accompanied by this level of commitment. Why this is important is because this would impact the benefits. As soon as you have a budget, you have an allocation to a certain group of patients, you know which medication or interventions are going to be utilized, and those can all be quantified as benefits in monetary terms. We're not even talking about at this stage quantification of societal benefits or quantification of productivity related benefits, which can also and should also be included in cost benefit analysis. We're simply talking about, in simple budgetary terms, a commitment for funding of newer healthcare technologies. So if we're looking at applying a cost-benefit analysis, it's quite challenging in the context of this HTA methods guide to determine whether this HTA system will in fact result in benefits that far exceed the costs. Let's jump into, but before we get into costs, I want to talk about history in the introduction of newer healthcare technologies in South Africa, and then how that has potentially also impacted the benefits. Trastuzumab, case in point, was included under the essential medicine list by the World Health Organization in 2015, but it was only included in the EML in South Africa in 2017. For breast cancer, trastuzumab, that is. I know that there are specific sub-indications and nuances, but here I'm speaking more in general terms. So it took a full 2 years before trastuzumab appeared in South Africa's EML. I'm quite sure a lot of mortality and also morbidity could have been averted by introducing trastuzumab sooner. That's using the World Health Organization Essential Medicine List as a benchmark, and we know broadly that the WHO EML does not keep pace by any means of the development of introduction of newer healthcare technologies by HTA agencies in many of the leading high-income countries and OECD countries. So we're still working with a lagging measure in the form of WHO EML. Another case in point is bevacizumab, Avastin, for colorectal cancer. EML in the World Health Organization in 2013 appeared in the South Africa EML in 2015. Rituximab for non-Hodgkin's lymphoma, 2015 and 2012 in the South Africa EML. Nivolumab, though, for melanoma and non-small cell lung cancer appeared in the WHO EML in 2019, to my knowledge, does not appear at all in South Africa's EML. And pembrolizumab for melanoma and non-small cell lung cancer also appeared in the WHO EML 2019, but does not appear. So these are the benefits associated with access to newer healthcare technologies could be significantly improved if the timeline for the introduction into the EML would be significantly reduced, and perhaps the methods guide will lead us in that direction. So having said that, let's jump into talking about the costs, which are a little clearer. And if a health technology system is brought into existence through the national health insurance system or broadly application within the public sector, we have a clear indication of what the costs are. So for instance, on page 15, let's have a look here. Okay, is a articulation or noting of who would be involved internally in processing and putting together the technical assessment and the appraisal and final recommendations. A lead reviewer assigned to the TAs responsible for finalizing the TA scope in consultation with the EDP staff, so the National Essential Medicine List Committee, relevant stakeholders that would be involved. And I'm mentioning this specifically because presumably additional budget would have to be allocated for these activities. So that amounts to additional cost for running the program. Another reference that points us in the direction of requiring additional resources for this is that the guide could be used by anyone, but specifically contracted external reviewers. Perhaps some of the functions that should be taken up by the National Department of Health are going to be outsourced. We're not sure at this stage the value of those contracts and how much would be paid, or how much is going to be covered under the Better Healthcare program that is funded by the UK government. Appointing internal staff and secretariat, perhaps additional capacity may be required, and ministerial appointed advisory committees, also perhaps additional capacity may be required, is all suggestive of additional costs for running an HTA system. It is unclear at the moment what those costs are, but they would be significant if the volume and the demand for newer healthcare technology assessment increases from 2021 perhaps to 2022, the following year. So those costs are all aggregated and then utilized in a cost-benefit evaluation. Also paying for external consultants that I've just mentioned over here. So there's still some uncertainty in a cost-benefit evaluation of a HTA system, which brings us to the next element of looking at the cost-benefit analysis of this HTA, which is what are the alternative options that are available. Perhaps HTA system in South Africa is not the most efficient way to address access and improve access to newer healthcare technologies. Corruption in South African healthcare system is quite high and results in significant unnecessary expenditure. Case in point is, for instance, a recent report where the Minister of Health in South Africa has been put onto special leave since the 8th of June after allegations of involvement in tender irregularities related to the awarding of a Digital Vibes tender. More specifically is that the Minister of Health may have, or is alleged to have, received directly or indirectly gratifications from a controversial company, Digital Vibes. And Anban Pillay has also been involved in this controversy by pressurizing officials to ensure that Digital Vibes got the contract and was awarded. And where corruption has a cost associated with it is because at least 650,000 Rand flowed from allegedly corrupt Digital Vibes contract went towards startup costs for Tammy Taylor Nails Outlet, And Maverick also uncovered monies totaling at least 446,000 that have been diverted from their 150 million rand DOH contract to account for a new hair salon, Gold Ace Cuts and also Curls. I'm sure there are many patients that could have benefited from the 650 and this 446 round number of a million rand that could have benefited from additional access to trastuzumab or pembrolizumab, for instance, or newer healthcare technologies. If corruption were stamped out, these monies would be freed up and available without the need for a health technology assessment system. Another example relates to, or an alternative for an HTA policy to achieve access to newer healthcare technologies is medico-legal expenses. These have ballooned out of control in South Africa for various reasons. Some of them include malpractice in the public sector. It is also related to predatory law firms clearly exploiting opportunities to increase their share of income from the public sector. Be as it may, in reality, it still represents a significant chunk of funds. This recent report related to the Eastern Cape notes how they are applying to freeze 364 million rand. And taking into account that Eastern Cape is still a small province, there are still others in South Africa that are much larger and far greater budgets. But what this report is stating is that 364 million in medical negligence awards, as well as to stay any other orders against the Eastern Cape Court, interim against 21 legal firms and 41 successful litigants. I'm quite sure, again, that if Eastern Cape ran its public healthcare sector efficiently, that perhaps this 364 would be available in the future to be allocated rather to improving access to newer healthcare technologies in South Africa through improvements in their efficiency of the healthcare system. And this would be a far easier approach, possibly, if you're comparing the benefits and the costs of the different alternatives, far easier approach to allocating available funds within the budget to newer healthcare technologies without necessarily implementing a large and possibly bureaucratic health technology assessment system. Other options for consideration as well is value-added tax. VAT is still charged on medicines in South Africa. Potentially that could be waived for medicines, or alternatively, if that still continues to be charged, that amount could be ring-fenced and redirected into an innovation fund that is utilized for funding newer healthcare technologies in a sustainable way year on year. And another potential option is reducing military expenditure. South Africa's neighbors are peace-loving individuals. They are not aggressive. It's a broad generalization. I know that. The borders are porous. Individuals leave and come as they wish. So perhaps the safety of individuals in South Africa is not at risk. Potentially healthcare funding could be sourced from military expenditure. I don't have specific data to back that up, but that is another potential source for funding as well in the future. So those are a few alternatives. It's a health technology assessment system as envisaged in this document over here, the methods guide. What are the benefits? What are the costs associated with it? And the benefits here is ultimately access to newer healthcare technologies. Or are there paths to achieving the same objective with greater benefits at a more efficient process or less costly process? And some of those alternatives I've already mentioned, which is reduction in corruption, reduction in medical legal expenses, removing VAT from medicines, or alternatively ring fencing or reducing military expenditure as another option. So that's a wrap of this recording. In summary, we spoke about the cost-benefit evaluation of the health technology assessment process based on the OMB circular number 4 in the United States of applying cost-benefit evaluation to decisions related to policies that would be implemented in a country. I hope you found that useful, so stick around for video 3 and then also video 4. Take care.